Okay, so the next topic that we're going to be discussing is idiopathic thrombocytopenic purpura, which is a very important part of pediatrics. And this often comes as a long case, as a short case, and also as MCQs and SCQs. So let's take a look at the important points of ITP or idiopathic thrombocytopenic purpura. Now, what will be the important clinical presentations of this disease? So it can present, since in this disease there is antibodies against the platelets, so there is a deficiency of platelets, which can present with spontaneous bleeding. Now, spontaneous bleeding occurs when the platelet count has reduced to less than 20,000 per cubic millimeter, and it can also present with easy bruising, epistaxis, menorrhagia. Epistaxis and menorrhagia occurs when the platelet count reduces to less than 50,000 per cubic millimeter, and in adults, females are more affected, and the signs and symptoms of connective tissue disease can also be there. And this is why whenever we are considering a case of ITP, we also include connective tissue disorders as DD or differential diagnosis. Okay, so you need to know that in case of ITP, there will be no organomegaly, like there will be no splenomegaly or hepatomegaly, and there will be no lymphadenopathy. This is characteristic of ITP, that there will be no organomegaly, there will be no lymphadenopathy, and these two are the characteristic for leukemia, okay, or aplastic anemia or any malignant disease. So it will present with bleeding diathesis, spontaneous bleed, easy bruising, epistaxis, menorrhagia, and in children, both genders are equally affected, but in case of adults, females are more affected. Okay, so how will you investigate a case of ITP? Number one, you will do CBC, which will show thrombocytopenia. You will do a bone marrow examination, which will show increase in the megakaryocytes. And we also need to exclude any B cell malignancy when looking at bone marrow analysis. And the bleeding time will be prolonged since there is a deficiency of platelets. Tourniquet test, which is also called as Hess test, which will be positive in case of ITP. And autoantibody testing will be done if we are suspecting a connective tissue disorder. If we are suspecting a connective tissue disorder, then we can do autoantibody testing like ANA, etc. And you should also do HIV and HCV testing in order to rule out any infiltrative disease of the bone marrow. So CBC, bone marrow biopsy and analysis, bleeding time, tourniquet test, autoantibody testing, and HIV and HCV testing. These are the important investigations that you need to carry out in a patient of ITP. Now, what are the important treatment options available for treating a case of ITP? Number one, the treatment can also be supportive in the early cases when the platelet count is in the adequate range, and supportive treatment includes avoiding any trauma to the patient and avoiding any antiplatelet drug like heparin, like aspirin, okay. And the specific therapy includes the first line will be high dose glucocorticoids like prednisolone or dexamethasone, and the second line drugs will be immunosuppressive therapy like azathioprine, methotrexate, leflunomide, etc., along with splenectomy. So splenectomy is mostly done in chronic cases of ITP. An ITP case is labeled as chronic when it lasts for more than 1 year. So then we can also go for splenectomy and any immunosuppressive drug. And the third line therapy will be a high dose of steroids along with IVIGs or intravenous immunoglobulins, with or without anti-D immunoglobulins. So anti-D immunoglobulins can also be considered as a treatment option for ITP. So as first line we have steroids. Second line we have splenectomy with immunosuppressive therapy, and for third line we have high dose steroids along with IVIGs with or without anti-D immunoglobulin. So these are some of the important clinical features, investigations, and treatment options available for idiopathic thrombocytopenic purpura or ITP. Thanks for watching.